So hi everyone, welcome to our second episode of podcast of 𝘼𝙨𝙙𝙀. So in our first episode, we have discussed about the mental health between Daniel and Miss Evelyn. We have heard about that. So today we will talk about epilepsy. Before that, good evening, Dr. Danaraj.
Yeah, hi, good evening. Thank you for having me.
Thank you also, Doctor, for being here today. So how are you, Doctor?
Yeah, I'm good and a bit tired.
Yeah, I'm a bit tired. So I'll make this very fast podcast. But actually, okay, so today we will talk about epilepsy. As we know, on the 8th February, the world celebrated the International Epilepsy Day. So I will talk about briefly about epilepsy, International Epilepsy Day. It started in 2015 and organized by International Bureau for Epilepsy and International League Against Epilepsy. So based on my readings, I found out that this day is aiming to provide a platform for people with epilepsy to share their experiences and stories with the global audience. Other than that, the day also calls for all people to advocate for appropriate legislation that will guarantee human rights of people with epilepsy and encourages people with epilepsy to their fullest potential, to live to their fullest potential. So before that, actually, Doctor, can you briefly explain the definition and actually what is epilepsy?
Alright, so epilepsy is actually a disorder of the brain where there is a recurrent and unprovoked seizures. Yeah, so you can actually say that this is the tendency. That means someone who has epilepsy, their brain has a tendency to fire uncontrollably. So if the firing happens at certain parts of the brain, and those parts will be activated. So that's the simple definition of epilepsy.
Oh, I see. So it's like sometimes they can't control themselves because of the firing of seizures.
Yes, correct. Yes, but the important thing is that these seizures are not provoked. Means like nothing causing it.
Oh, no trigger that causes seizures, like just sudden
Yes.
seizures. Okay, I understand. So, as we know, a lot of diseases have a lot of types. Like when I learned in my previous class, I learned that hemoptysis has 3 types. So I wonder, is it the exact same for epilepsy? Does epilepsy have a lot of types?
Yes. If academically, the epilepsy can be divided into many different types, and this is probably important from an academic point of view. But from a clinical point of view, like when we see patients, the two most important kind of epilepsy is the seizures. I mean, it is simple seizure and complex seizure. So simple seizures means that you get a seizure that is very focused, probably in a limb or in your legs or twitching of the eyes, right? So these are simple seizures. But complex seizures means you lose total control of yourself, where you have the loss of consciousness. So just the two simple classifications are simple and complex seizures.
Oh, so it's just the difference between those two. One is specific part and the other one is for the whole body. Sudden seizure for the whole body and specific part. Okay. So I did some readings about seizures. So epilepsy is a patient with that encounter multiple seizures, like untriggered multiple seizures. So actually, is there any difference between seizures and epilepsy?
Oh, okay, very tricky question actually. You must have seizure to be diagnosed as epilepsy. Epilepsy is a diagnosis.
Oh, I see.
So means a doctor makes the diagnosis, but seizure is more like a symptom where the patient tells you or the mother tells you.
Oh,
my son had a seizure. My father had a seizure. Yeah.
And the diagnosis
so epilepsy is a very specific
epilepsy.
diagnosis.
What about convulsion, doctor? Convulsion.
Okay, convulsion is a type of seizure. Seizure itself can be divided into two kinds: motor seizure and non-motor seizure. This is actually quite interesting. Motor seizures are convulsions. If you have like the jerky movement of your hands, these are convulsions, right? Non-motor seizures that we often do not focus on are like if you see visual hallucinations or auditory hallucinations or olfactory activations. These things are also different kinds of seizures as well. Have you heard of the word deja vu?
Yeah, I've heard it. When we feel like something that happened to us repeating over and over again.
Yeah, correct. So that is also a kind of seizure actually. So
I
that is
see.
a non-motor seizure.
So non-motor seizure is undetectable by the other person, right? So that only person can detect you have the non-motor seizure. Oh,
Yes,
I see.
Yes, to some extent, yes.
Okay. Based on my readings also, I found out that epilepsy has a lot of stigma in our community. A lot of people think that epilepsy is contagious, or epilepsy patient with epilepsy will be mad and will be like a mad person and must be locked, or they are possessed with some kind of spirit. So actually, doctor, what is the causes of epilepsy, and is it contagious to other people?
Okay, first off, epilepsy is not contagious, right? For your question, like what causes epilepsy, one of it is genetics, meaning that if you have certain genetic mutations, then you have a risk of getting epilepsy. A simple way to see this is if you have family members who have seizures or epilepsy, then most likely you have a higher risk of getting epilepsy. I think that's quite straightforward. Other than that, if you have anything such as head trauma, right? Someone from an accident, you have an injury, or you have stroke, right? There are certain parts of the brain that have infarcted, and other than that, the brain tumors, you have things that actually change the anatomy of the brain architecture itself. Then you have a higher tendency to have that uncontrolled firing. So these are some of the causes of epilepsy. Of course, not to mention, there are also epilepsies that we don't know the cause, that we classify as idiopathic causes.
Oh, I see. So epilepsy is a kind of inherited disease.
Yes, that's most common. That is the most common one. Yes.
Okay, so the person who have injury also can develop epilepsy, injury to the brain. So what about the kids that always have high fever and they will cause the damage to their brain? They will also cause epilepsy. The babies.
Okay. Very good. That one, like this, for you to say that it is an epilepsy, we need to fulfill a certain criteria, right? The children who have fever and then they go and have a seizure, that one we call as febrile seizures. So just because you have a seizure doesn't mean you have epilepsy.
Oh, I see.
Yeah, you
So
need
it
to
must
fulfill a
be
certain criteria. Yep.
multiple seizure, multiple untriggered seizure.
Yes.
Multiple untriggered seizure.
Unprovoked seizures. Yep.
Is there any duration or any timeline for those two seizures to occur that must be diagnosed with epilepsy?
Oh, the two seizures, is it? So the two seizures
Yes.
cannot be consecutively, meaning that you cannot have the seizure now and then 2 minutes later you have another seizure, you're still not considered to have epilepsy. You have to undergo some diagnostic tests, MRI, EEG, to see whether you have the trickle pattern or not, to be diagnosed as epilepsy.
So it can be concluded that everyone have the chance to develop epilepsy.
Oh,
right?
yes, everyone.
Yeah,
Yes.
everyone can have epilepsy. So this is the really
correct.
important things that we know about epilepsy. So doctor, I've watched a few video of epilepsy patient that having seizure, but I can actually differentiate their seizure with the normal people. such as I watch videos about Tourette syndrome also. So is tics in Tourette syndrome is the same as the seizure that epilepsy patient having?
Okay, Tourette syndrome is a subclassification of epilepsy. Like I told you just now,
Oh.
epilepsy simply means that the brain is easily activated. They are unprovoked recurrent seizures. So Tourette syndrome is unprovoked and it is recurrent, right? So it's a subcategory of epilepsy, correct?
Oh, I see. So under epilepsy also there is a lot of syndrome regarding under epilepsy.
There's a lot of other syndromes. Yes.
I see. Wow, I'm quite clear about what is actually epilepsy, because I thought that Tourette syndrome and epilepsy is different things. But I found out that actually Tourette syndrome is under epilepsy. It is epilepsy. So my next question is, what should we do like when we encounter someone that is having epilepsy? What should we do?
Okay, you mean the first aid of it, is it?
Pardon? The first?
You mean the first aid care?
Yeah.
Okay.
Yeah.
So I think it's important for people to know the first aid, because like we discussed just now, everyone has a risk to get epilepsy or seizures, right? So the first thing is, if you see someone who has a seizure, you have to slowly bring them down to the ground. Bring them down to the ground. Okay, don't let them stand because they might fall. Bring them down to the ground and then turn the person to one side. We call this the left lateral position, or just whatever side lah. Just turn them to one side. This will allow them to, if they vomit, then allow their vomit to come out and not get choked. And also will open up their airway so that they can breathe. Put them on one side and then clear the surrounding area. If there's a table or a chair or something, push those things away so that they don't knock into something. You know, if there's a chair there, they might knock into it, because during this time they cannot control their movements, right? So they might tear a earlobe, they might knock their head and get the intracranial bleed. So these things can be avoided. After that, put something soft on the head, like a pillow or a jacket or something like that. Then loosen their necktie, or if they're buttoned up like that, loosen it up so that they can breathe, right? Check on them if they have any medications or any labelings that saying that they are high risk to have a seizure. Some of them might have medications on them that to be prescribed immediately. And then of course, if the seizure lasts for more than 5 minutes, you have to call 999. I think apart from that, I want to also mention things that you should not do, someone should not do, right? Because I think a lot of people might have a wrong perception about this. The first thing is, don't hold them down, don't restrict them, let them move freely, because when you restrict their movement, they might tear a muscle. You know, if torn ligament, tear muscle, this is a clinician's nightmare. It's difficult to treat now, and it takes a long time to heal. Okay, that's one thing. The other thing is, those days people used to believe to put things in your mouth, like iron bar or something like that, to prevent them from biting their tongue. But studies have shown that people don't do that. And even so, if let's say they do bite their tongue, it's easier to treat. You can suture it, so it's quite easy. So don't put anything in the mouth, right? And then don't give them water or food. Tak payah, no need. So just let them have the seizure, and once as you clear up the airway and you check their surroundings, clear the surroundings, call 999. If it is their first time, they must be investigated.
I see, doctor. So it is actually very important for us to know all these steps, right? We don't know when we will encounter either strangers or our friends that will face the seizures. It's like Tourette syndrome. I remember one day, a few past months, and there is a patient who is having Tourette syndrome, making a TikTok videos to spread the awareness of Tourette syndrome at TikTok, to spread awareness, to say that you must really know that there is this kind of person that having Tourette syndrome, and you must not have a bad impression on them, like watching them with weird gaze like that.
Yeah.
So it's really important for us to know. But what happened to the girl? I think there are also a few haters, some haters that make her put the video down. So it's kind of saddening actually. Yeah.
Sad. Yes.
Our kind of community nowadays. So as we know, we all have the risk of having the seizures and epilepsy. Can we do like some precautionary steps for us to prevent ourselves from getting epilepsy?
Oh, this is a difficult question, because the trigger of epilepsy is not clear. It's different for different people. Usually, someone who has been established with epilepsy, they might have a trigger. For example, like flickering lights or some emotional stress. These things can cause a seizure. But for the general public, it's very difficult. There is no one thing that causes a seizure, if you understand what I mean. So for those, so triggers are not universal. So meaning that flickering lights, some people are okay with flickering lights. Have you seen a disco? The lights are always flickering, but nobody goes into a seizure, right? Yeah, but some people do. So there are some movies that they put, they are flickering lights, so beware and this kind of stuff. But from a clinical point of view, this has not been shown to be very much valuable, except if the person already has epilepsy. So if someone already have epilepsy, some things that they must do is, of course, number one is take their medications, right? So if you do not take your medications, you are going to have a seizure soon. Other than that is adequate sleep, right? Stress, keep your stress levels to a healthy level, right? Do not be too stressful. If you're too stressful, go see a doctor, try to work it out. Alcohol, intake of alcohol increases your risk of having a seizure, right? Too much of alcohol, especially when the alcohol leaves your body. So that's when you have a lot of seizure events. Another one is flickering lights, I mentioned that. And having regular meals. Regular meals is important because some studies, very isolated cases, but some studies show that someone who has an empty stomach, right, you have gastritis going on, then you can trigger a seizure. So these are generally some of the things that you can do to prevent a seizure.
So the person who have epilepsy can have like the definite way of precautionary step, but not of all the persons. So we just need to take care of ourselves well, reduce our stress, and take care of our meal, live a healthy life basically, to prevent ourselves from getting seizures and epilepsy. So doctors must be aware, because doctors are having a lot of stress.
Yes.
Must keep your stress down always. Okay, so I think that's all for my questions today. I think that's not. Yeah, I would like to ask more. I have a question earlier, but I remember. I just remember the question. So based on my readings, it is said that 70% of the epilepsy patient can be treated and having no seizures life by using medications. But there is still a lot of people that cannot get the treatment. So based on your opinion, actually, what is the reason they cannot get the treatment?
You mean cannot get the treatment, like after they take medication, they still have seizures? Or you mean...
No, I'm afraid that some of them cannot get the access for the medication. Yeah.
I think this is very much related to awareness. I think a lot of people are not aware. Like you mentioned earlier in our podcast, that a lot of people think ada makhluk halus masuk and things like that. So they try to berubat kampung, right? They try to berubat kampung, and this leads to different problems. So I think awareness is very important, because we have medications for this, and you have to see a doctor for this. You cannot buy medications over the counter or believe in folklore to treat this. So awareness is very important. Thanks to your podcast, I hope a lot of people will hear about this.
and not going to some kind of WOMO to
Yeah.
to cure or Tourette syndrome and epilepsy, because it is
Yeah.
actually a diagnosis, is not a possession, some kind of spiritual possession.
Yeah.
So I think that's all for today's podcast. I think that concludes what the important things and the vital things that we must know about epilepsy. And I really hope that your information will help a lot of people to be aware of what is epilepsy and how to manage with epilepsy patient and all of that. Thank you so much for being here with us today. For giving us all the information about epilepsy, and I wish you have a nice day. And thank you, Dr. Danaraj.
Thank you, Shamira. Thank you for the opportunity.
You're welcome too. So thank you guys for watching till the end of this video. I hope this video will help you to understand about epilepsy. Stay home, stay safe. If you want to go out of your house, follow the SOP because we are still fighting the COVID-19. Don't forget to like, share, and subscribe. Bye.